This is Dr. Frank Sutton with the final session that I'd like to go over with you and do some bit of a recap and make some suggestions to you about in particular an app, a free app from the App Store or from the Google Play Store called Quit Genius. Quit Genius will be very helpful. It's a free download, and it has much of what I've covered, but it has some charts and some things that you can download that will be of additional help to you. Quit Genius. Now, there's also Quit Lines. Quit Line is a 1-800 number or a local number where you can receive some free nicotine replacement therapy that is some of it is non-prescription, but they'll send you those free of charge. Some of them actually have some clinics where you can go and have some further instruction. But you need to call your local Quit Line, and you can look that up in your Yellow Pages or under Yelp. You can put Health Department, Smoking Cessation, number of things you can put in browsers and find a Quit Line for you depending on where you live. But it is helpful. They do call you periodically. You have apps on your phone that are reminders. There are accountability. Accountability is important. I did talk to you about notifying your friends, your spouse, or others about your intent to quit and your quit date. Those are all very, very important. And I do want, for just a moment, to focus on some high-risk groups to encourage you in particular to be very serious about getting all the help you can and taking these videos and these handouts and this mail package very seriously, and perhaps even calling us and setting up a time for 1 to 1.5 hour sessions with 1 or 2 physicians to help you facilitate this program. We'd be glad to do that. The fee for 6 sessions is $180 for an hour and a half of dedicated cardiovascular or pulmonary specialist time, and that money, as I said, goes to American Pulmonary Medicine Institute, not to the physician. So we're really doing it gratis for you and for the benefit of your health. But let me talk, if you have angina, if you're having chest pain on exertion, you're at high risk. If you're having leg pain on exertion, you're a high risk patient. If you're having shortness of breath on minimal exertion, wheezing, cough, and mucus production, you have lung disease and you're a high-risk person. Your health is going to deteriorate rapidly, all of these situations, if you continue to smoke. And finally, one last group, pregnant ladies. Ladies, when you achieve pregnancy, it is hazardous to your fetus, to your baby, for you to smoke. They'll have low birth weight. You'll have an increased instance of fetal loss, of spontaneous abortion, placenta previa, that's where the placenta actually is in the wrong position and begins to hemorrhage. If the child is born with small birth weight and you have continued to smoke throughout your pregnancy, their chance of sudden infant death is markedly increased. They will have some developmental problems. When they're examined at age 4 or 5 for mental stability or ability, they'll be behind their age-matched children from non-smoking mothers. So you do yourself and your infant great harm and disservice. It's just not right for you to do. So I would encourage you, if you are a young lady who could achieve pregnancy and you're a smoker. Now, 2/3 of smoking mothers continue to smoke some during pregnancy. It's a terrible statistic. I hate to tell you that, but I'm encouraging you, whatever you do, stop. Stop before you plan to get pregnant. Clean your body up. Get healthy. Get your diet healthy. Get rid of cigarettes. Start an exercise program so you'll be healthy, so you'll have a healthy infant. And then whatever you do, don't start back and don't let your husband smoke around an infant. Children who are born into the home of smoking parents have increase in respiratory infections of all type. They have ear infection. They're irritable. They feed less well. They sleep less well. They have these chronic bronchitis. If they are exposed to other children with respiratory illnesses like in daycare, they'll get it. Let me tell you, their immune system is suppressed. It's not strong when they're young anyway, and living with smoking parents suppresses the immune system of children in addition to rendering their lungs inflamed and likely are predisposed to infection. And that infection may not be a simple infection in an infant with small airways. So pregnant women, people with heart disease, established heart disease, particularly with angina, with pain on walking, claudication of the lower extremity, and people who've had a stroke or have had a TIA, tremendous risk for another stroke or recurrent TIA if you continue to smoke, and then any of those with lung disease, with COPD, chronic bronchitis, asthma, all of these are risk factors. You all, it's very important. You're the last group I want to encourage as strongly as I know how. Whatever you do, get on this program and become a non-smoker. By saying that you can do it, your mind is powerful and you must reprogram. You have both habituation and addiction. You understand addiction when you understand that the pleasure hormones in the brain are released, 6 or 7 of them, when you smoke a cigarette, and that you have increased receptors and they're upregulated after you've smoked for a while, but those receptors will downregulate and will decrease in number if you stop. Your exercise capacity can increase, your lung capacity can increase. You have a number of things that start reducing your risk. You will become a relaxed person who will be able to handle stress in different ways because you will learn relaxation techniques, passive muscle relaxation, doing the breathing exercise I showed you to the accompaniment of yoga or music or something. Post-exercise, you're more relaxed. I want to encourage you in all of these things. And then I'm not a dietitian, but I would tell you that if, when you stop smoking, you get rid of everything that's white, bread, sweets, and things that are white, and concentrate on red, yellow, orange, and green, fruits and vegetables. Virtually follow a Mediterranean diet. You will not gain appreciable weight. You will gain lean body mass with your exercise, and what weight you gain will be healthy, muscular weight, and you will be feeling better and functioning better than you have in a long, long time. This is our encouragement to you. Now, there's much more we could go in, but I think these sessions will get you started. And if you want a private program that you're willing to pay $180 for 6 sessions, let us know, and we'll try to set that up. Let us know through apmi@me.com, which is shown here. And also let us know if you'd like some handouts on the clocks and the benefits of smoking, cessation, and so on. We have a package we'll send you from the American Pulmonary Medicine Institute. Once again, this is Dr. Frank Sutton signing off and wishing you the very best. Here's to your good health from all of us at API.